Welcome to the Growth Unbound podcast. I'm your host, Gavin Baker. It's great to have you here. Join me as I sit down with accomplished leaders in the healthcare industry, diving deep into their experiences, challenges, and triumphs when using innovative marketing strategies to drive growth in their organizations. Welcome to Growth Unbound. Today we've got Kayla Gregg, Clinic Director at Tennessee Orthopaedic Alliance. Thank you so much for being here today.
Thanks. I'm excited. I've never done anything like this before.
Well, you're going to do great. You've already done great in the pre-show. So excited to have you. And really excited to hear you tell some of the stories of your growth as well as just your company growth as you guys have moved forward in many new different ways. Yeah. So I think the first place is always really great is where did you were sharing a little of your story. Where did you start, right? So you're clinic director now, but take us back a few years. Where did you start?
Oh gosh. So I started in healthcare throughout college. Yeah. I was trying to get my bachelor's degree in housing and design. And the only thing that really got hits on my resume here in Knoxville was my previous work experience. Okay. So Tennessee Orthopaedic Clinics at the time hired me to work front desk at one of our biggest offices. And they gave me an opportunity to do authorizations. Yeah. I got to dabble in HR stuff. And then I got to do marketing. And then somehow I became a clinic director. They put me in charge with running with scissors.
And how long was that?
I've been with the company going on 14 years now.
Okay. And how long as a director?
As 4.
Okay.
Yeah. So I'm still fresh in the director world.
So take us back to that. What was that change? So what role were you before? And then you became a clinic director. So what was different about the two?
So I was doing on-foot marketing and then I became a clinic director. So essentially they had a lot of similarities. It was just with a different audience, essentially. Yeah. It was out in the community versus doing some of the same things that I do, but internally for staff and physicians. So.
And in that kind of transition, sometimes there are things that become hard that you didn't think would be hard or unexpected. Tell us about one of those.
One of the harder parts is it's easy to be out in the community and market the services that we do and kind of put a smile on your face. But then sometimes when you're in the clinic, you see the raw footage of what's going on behind the scenes. And sometimes it's sad. And then a lot of times it's happy because the patients are getting better. And then another challenge I faced was just kind of leading some of my peers. That one's been the toughest probably through being in an admin position.
Yeah. Tell me about that.
So I like to be everybody's friend. I have a competitive nature. I want to be the best at everything I do, which is a reason why I'm talking to a therapist. I think everyone should have a therapist. But, some of these people I worked hand in hand with, and we were doing some of the same responsibilities. And so then now I was put in charge of making sure that the ship was running efficiently. And there may have been some things that weren't really being ran efficiently. Sure. And so it's hard when you go to a peer to say, hey, you're really good at this, this, and this, but let's try to pivot over here for this end result. Yeah.
So is that your typical approach, is starting with that?
I call it my sandwich method, good, bad, good, and put it together.
Yeah, sure. So, has it been effective?
I think so. I think it would be interesting to ask my team. And that's something that we're actually doing as an organization. We're working with a company for just rebranding our internal culture. Yeah. And I hope it gives some really good feedback based on what we've been told, truly an anonymous platform. And so I would love to hear my staff let me know, I love this, I hate this, because I'm all about pivoting and love languages and speaking your love language.
Sure.
So,
what was the catalyst to do the internal culture piece?
A lot of it was turnover, and then surviving COVID, and I hate to say that and use that, but our physicians, they worked so hard to keep every single one of us employed full time, which is a great selling point, but I think a lot of us were just fatigued. Yeah. And our day-to-day stuff changed. And so how do we make sure that we're doing all the right things to support these people that are our biggest assets and resources? And then how do we just be sure that people feel good on a Sunday afternoon about what they're about to walk into on a Monday morning? So.
Well, I think I think the stories in the news, and you see it, kind of the post-COVID effect of, burnout and all these different pieces. But I think we typically think of that as like on the provider level, these nurses, and then now everyone's moving to travel nurses, or you got, all the mental overhead with doctors and staff. And I think the challenge that we felt internally too is we at our company didn't really have an off either, right? Because we're doing all the communication around office openings or closings or like masking or not like all this kind of pieces.
Yeah.
And the same is true for your team of like, hey, maybe we're in, maybe we're not, but you're still stretching thin people who are still dealing with all the realities of life and death and all these other things that have happened because of COVID. And where plenty of people, didn't go to work for months, right?
Yeah.
Which it's a different set of realities, but it's kind of silent in the sense of like, well, you still went to work. And it's like,
Yeah.
it was a very different work.
With our growth, we're excited that we merged with TOA,
Okay.
and that's been several years in the making, and we're officially rebranding.
Yeah.
But I think we thought our staff deserve the same kind of marketing that our community and patients and primary care offices.
Yeah.
So
is what kind of pieces is that going into in terms of like the approach with the staff? Is it language? Is it?
yeah. I'm not going to speak on a department that I'm not doing things in, and I have a magical marketing team. So proud to work with them, but they've done a lot of communication to the staff on our internet platform, sending emails, coming out to the sites to visit, and essentially marketing with our staff like they would a primary care office or another facility.
Helping them understand the differences and what's going.
And then, kind of reinventing some of our appearance policies, kind of bringing us into the times, allowing some things that maybe we were a little bit more structured about in the past, and then honing in on certain things like a color scheme, but then encouraging people that we're still TOC and we're going to, it's going to take us a long time to grow into this TOA. So let's use our TOC stuff. Let's wear our TOC branding things.
So when you say appearance policies, pull on like what that looks like day to day.
So appearance policies, honestly, during COVID, it got really laxed because we were just so excited to be there and that everybody was healthy and well.
We're
like, you know what?
Thank
just
you for showing
show
up
with a smile on, and we'll figure out the rest after the fact. But actually, it was an employee-led committee. And they all came, and I'm talking hourly staff members that are medical assistants, front desk, they're maybe even working remote. They came to us and said, I think that we really need to revisit this appearance policy because it's causing some confusion in day to day what people can and can't wear. And I just don't think we look as professional as we all actually are.
How neat. That's so great.
I know.
Yeah.
So I'm really proud of the committees that we have.
Yeah.
And again, I can't take credit for any of this. I work with a really fantastic crew that got the whole core team committee started. And then off the core team, you've got your employee experience and then now the patient experience, which I'm fortunate enough to get to sit on, and I'm excited about that.
Yeah, so we were talking about that a little bit. So what is that for you, for TOA, what's that look like? What's the patient experience committee look like?
It's very fresh. So right now, it's all of us just trying to figure out what we want to make a change, how we can move the needle a little bit. We all come from different areas of the clinics and the billing cycle. So we're just all kind of putting our heads together. But we know that we have one goal in common, and it's to make the patients feel better mentally, physically when they walk into a facility or when they interact with our team.
Yeah. Is there a key driving point everyone's beyond that? Like, hey, the first thing is this. Has there been something you guys are aligned on in that sense?
Yeah, so we all did a brainstorming session and we gave out ideas, and a lot of us had picked heads for people in our, departments and things of that nature, just so that it wasn't just all our perception. And we listed them all out, and we kind of decided who had strengths in certain areas and who could collaborate together. And then we decided what's our low-hanging fruit? What can we hit the ground running with and show that we can make a difference in this organization for patient care. And then once we get a few of those projects knocked down, I think we'll revisit our big brainstorming list and see, are these still applicable, or have some of them resolved themselves because we've done X, Y, and Z.
So one of the low-hanging fruits, are there any that are like applied yet that you're seeing results from?
Really close, yes. So the parking situation, I am fortunate enough to work in our downtown Knoxville office, and I love it. I always have a garage space, and we have a lot more parking than a lot of facilities, but patients don't know that when they first come to us. It's very overwhelming, especially if you've not driven downtown and you're used to the one-way streets. So we've collaborated with marketing to get a better map that has some of our branding. And what a small little change, but it's given to patients prior to them coming into the facility to kind of ease their mind about it.
So, and that started from what? So the parking's an issue or a perceived issue. How did that come up?
So the conversation within patient experience was patients are often, scheduled for either an appointment or a procedure, and they think that they understand where and when, but then when they leave or they in that conversation, it's almost like they get foggy. And I know that to be true for my own experiences in medical. And we just decided, how can we remove ourselves from what we know to be the truth and put ourselves in the perspective of a patient?
Sure.
What can we give the patient to ease their fear or their nervousness about walking into a facility or having something done?
Yeah, that's super smart. Well, and it starts with, what I love about it is it starts with such a basic, almost like Maslow's hierarchy of needs, right? Like, how am I safe, right?
Yeah.
And certainly they're safe, but the fear or the anxiety is, well, I'm not going to be able to find it. I'm not going to find parking, or I don't, and people seem to have a habitual kind of concern about parking in, relatively downtown urban environments, just like people, right? Not patients. And so you apply it to that, to a thing that's already maybe uncomfortable and escape. So the map's made.
The map is made. We've increased the parking validation to where we're covering all of the parking costs.
Okay.
They just have to get a sticker to put on their ticket, just some small things like that. But we're still working on preoperative packets.
Okay.
That all the patients that are having surgery, they get a map of where they need to go in the hospital. And, it would be really neat to have a fancier technology.
Sure.
But right now, it seemed like it was a quick fix. It didn't cost a lot of time, money.
Yeah.
If it's just a few patients that we can do better with, then that's fantastic.
Yeah.
So,
did you see what we see with clients sometimes is there are those kinds of experiential things show up in like Google reviews or public reviews? Did they show up there in that kind of a way?
Yes,
Okay.
They did. Yeah. So a lot of the reviews are their perception when they walked in and how the whole service went, and then a lot of it stemmed from that they wouldn't specifically say, I drove around and around and looked for a parking spot. But then once you started reading into the review, that was honestly the taste that they had before they walked into the facility.
Yeah. They're
and
frustrated
it made it
before
either good or bad.
Yeah.
So.
Yeah. There's a book I've been reading called Upstream. The subcontext is solving problems before they start, right? And that's essentially what you guys just did, right? You're making someone in a happier frame of mind before they walk in through the door, right? Because the reality is everyone's going to have a bad day. You're going to get some of those. Everyone does.
Yeah.
But you just solve something where it's like, okay, they're going to be more likely.
Yeah. And nobody wants to walk in that door either.
No, right?
I mean, you're not walking in because you're about to get some Botox. You're walking in because something hurts and you don't know why.
Right. And you want some relief of that pain, but you're afraid of whatever the answers might be.
Yeah.
So one of the things that we talked about in the pre-call was kind of the after hours call services. So tell me more about that and what role you've played in that.
So we offer a walk-in clinic that's open until 8:00 at night, and then on Saturdays a variation depending on location. So that's been a huge help to drive patients that are newly injured or not sure what's going on. But then also it's helped with our post-operative care. Patients that have a concern can call in to our after hours line, and if the physician that's on call feels like they need to be seen, but it maybe not be an emergency room type scenario, then our providers at Quick Care can jump in and help with that. But to that point, we were using an after hours answering service because it's just much easier to use a vendor for that. Yeah. And although they were fantastic, but I think they were struggling with some of their own turnover. And so hold times were pretty long. So you had your ER nurses on hold for 30 minutes just trying to get a page to the on-call physician.
Wow.
And so that just caused stress for everybody. So we found a new vendor, and we worked very hard for a long time of teaching the vendor, what verbiage we use for what gets pushed to the on-call physician versus maybe just a house call physician. Yeah. And we've seen a lot of success with the hold times just being reduced.
Yeah. So is that the primary metric or KPI, is just the whole time that you're...
Yeah, the whole time. And then also you just want to be sure that those calls are accurately getting sent through, because we would not want a patient that has a question about their care or post-operative care and us not be there to answer them.
Sure.
And so you just want to be sure whatever system you use, it's going to be accurate.
Yeah. And that's often the hardest part of growth, is the thing that did work eventually stops working for one reason or another. Yeah. And then you got to come up with a different solution or a different system to accomplish the same objective, but at a different scale or problem.
Yeah.
So how long ago did those switches happen?
It was end of last year.
Okay.
So it's still fairly fresh.
Yeah. So is there a phase 2 of that, or is it?
No, I think, phase 2, it would be ideal that the ER staff could send in their own messages and not even have to sit on hold. So then they're spending more quality time with the patients in the ER.
Sure.
But that's going to be further down the road. But right now we're happy and it seems to be working on.
Sure.
So.
What's the biggest initiative that you're working on right now? The biggest, the one you're most excited about when you think about of all the day to day of what Kayla's got going on.
Yeah.
What's the thing you wake up and say, man, I want to make sure I have time for this today?
I think it's truly the patient experience stuff, even though we've already hit on that a little bit. But I think as we're getting bigger, which we're grateful for, we just need to still feel like that family, small town practice. And it's hard because you're seeing a bigger volume of things. Inflation's happening. Insurances are getting harder and harder to work with and get paid for. So, you're trying to be a business-minded person, but also making sure that you remember that patient coming in is not just a patient, 15 for the day, but that's somebody's mom or brother or something like that.
So how do you maintain that empathy or even maintain the empathy for the staff who are interacting with these patients, kind of first point of contact?
I think that's something that the patient experience team's working on, because let's be honest, I don't know if you feel like this. Some people are born with empathy and some are not.
Sure.
And it's hard to ask somebody to change.
Yep.
So we're trying to showcase all the people that go above and beyond and hopefully kind of develop that culture of, if this is what so-and-so's doing, that's really cool. I need to be more like so-and-so.
Yeah, for sure.
So. Yeah,
there's a restaurateur in New York City who owns a number of kind of top rated restaurants. And he has a phrase about hiring. He's got a whole book on this. There's a book on hiring, and he talks about he hires 51% for empathy and 49% for skill. Because he says, I can train skill. I cannot train empathy. You can't teach someone to care. It doesn't matter. They kind of either have it or they don't. And that, in a hospitality-driven environment, is actually what they need. They have to desire to actually care about the person. And some people don't. And you'll never get there. So,
and it's not that they don't care necessarily, but I think sometimes people forget to slow down and truly put themselves in that position. We're going to make mistakes.
Sure.
I work with such a fantastic crew, and I love going in with them every day, but we make mistakes.
Sure.
We made one recently where we left a patient in the lobby for too long. And, you break down what happened and what you could have done differently. But the thing that I drove home was, I want you to close your eyes and envision that is your grandpa who you just confided in me was not feeling well.
Right.
That got accidentally left out in the lobby. How does that make you feel?
Right.
So.
Do you feel like that was an effective mechanism for them?
You definitely saw some light bulbs of, oh gosh, okay, well, she remembered me talking about this person that I care deeply about and how I'm worried about them. And then she took the patient out and replaced it with someone that I really know. And so I hope it was a good method, but a lot about leadership is you kind of sprinkle stuff around and see what works and what doesn't work.
But does anything come to mind that you've tried and you're like, that was a fail, not trying that one again?
I think just wanting to resolve things super quickly. I've learned that sometimes it's better just to sit on it because you don't want to relay any frustration.
Yeah, with a staff member or something.
Or even, with a patient.
Yeah.
So
how do you keep track of it to remember to bring it up later?
And obviously it depends on how urgent it is.
Yeah.
But I just kind of keep a running, hey, let's talk about this.
Yeah.
And I try to get my head wrapped around it. And I'm a very analytical person, so I like to know the ins and outs and how easy it could have been to make a mistake, because it could be that we have a process flaw and we need to figure that out.
Yeah.
So.
And new things create new things. Change, the phrase we use around here is change creates change.
Yeah.
So then you have to figure out, well, what...
And humans just love change.
Yeah. Well, and I think the reality is that the environment's changing, right? I mean, everyone's doing things differently, whether that's from how you guys are doing what you're doing, or that's to the insurance, the payer side of it. So even just the expectations of, I was at a talk earlier, and I think this is the first time that there are 4 generations in the workplace at the same time.
Yeah.
Right. So just even that kind of, we're used to bridging 2 generations, or 2 more than your own. Now you're appreciating 3. Well, that's a whole different, how my grandparents communicate, your grandparents communicate is very different than how someone who is 18 communicates, right?
Or, how people tick or what makes people tick.
Right.
That, I like being passionate about that. I think it's important I'm from the generation where you leave your grievances at the door and you walk in and you do your job.
Yeah.
But to be honest with you, that's really hard for us as humans to do. So I think it's important to connect and figure out, what keeps you up at night or what gives you happiness.
Right.
Because a lot of times you see that reflected in the work that they do in the clinic setting.
So is that a question you ask your team?
Yeah. I try.
Yeah.
I definitely try to.
Yeah. How does that go?
It depends on some people just don't want to be asked. They're like, can you just shoot me an email and I'll get back to you with this?
Yeah, sure.
And then some people like to have in-person meetings, and I really try to, shut stuff down and devote solely to that, which is hard sometimes too. But.
Do you feel like the team shares their hopes and dreams and those kinds of things with you when you ask?
I think to some degree, but that's why I'm really excited for our culture project, because I think it gives people an opportunity to say what they truly feel without the pressure of I'm talking to my boss right now.
Yeah. The observation effect is real. The fact that you're there makes it a lot harder. So the reason I ask is I think it is not exactly generational, but I do think there are people who are happy to share kind of everything, right?
Yeah.
All the things that are happening in their life. You're like, that's an oversharing,
you
right?
probably experienced that with me on Friday.
No. But then there are times when I know, at least for me, like on our team, like I really do want to know what their hopes and dreams are, and how, and if there's anything I can do to help them accomplish them, I'd love to do that. But I can't do it if I don't know.
Yeah.
But it does feel like, well, why are you asking me these things that have nothing to do with what my day to day
what my job
here is?
functions are.
Why does that matter to you? And it's like, well, it matters because I care about you as a person.
Well,
but
it can help you figure out as a leader too. Are they better suited for something else?
Sure.
So.
Yeah. I actually just had a meeting with one of our team the other day, and I was like, the 3 things you just said, I did not know. And they were not complete tension points, but they had been points of friction. And because I didn't recognize them as the way this individual had kind of framed them. And I thought, I would just recognize them as points of tension or friction. The reality is they're actually these really neat things that we should be able to do something with and encouragement wise. And so how do we give kind of a headwind to it and say, or not headwind, a tailwind to it and say, hey, let's run that direction together versus running at each other. Right.
Yes.
And so, but I didn't know. Truly, I was like, this light bulb moment, which I'm a verbal processor. So, which my dad once told me, is like, you're a verbal processor. I was like, oh, great. Then I realized later,
what does that mean?
what does that mean? And it's
Thanks,
like,
Dad.
What that means is I really don't understand something until I say it out loud.
Or I ask a million questions about it.
Yep. And then my brain connects to that. And I'm like, I wish my brain didn't work that way. But there is a value in it because I'm like, I can see those pieces.
Yeah.
So, one thing you said earlier, we were talking about something with patient experience, and you were asking, you just kind of a series of rapid fire questions.
Oh, yeah.
And what did you refer to yourself as?
I'm an ask hole.
Yes. So she's the ask hole of her organization,
Yeah.
which is that a self-designated kind of crown?
No,
or?
so my colleagues and I were at a meeting or a conference, I can't remember, but it was presented on the screen, and you could instantly feel the energy of the entire table, which was all made up of us. They stopped what they were doing, listening, and turned around and looked straight at me. I was like... And I was like, you know what? You're right. I am the asshole.
Yeah.
I'm proud of that.
Yeah. So do you have a framework that you typically, because I love questions. So do you have a framework you follow when you are doing that? Or
I wish I could say I was methodical, but I'm just rapid firing questions all the time.
Yeah. Do you have a favorite question? Or favorite series of questions?
I don't know.
Yeah.
I don't think so.
Yeah. I bet you do. You just probably not.
I just haven't picked up on
you'll
it.
probably, after this conversation, you'll probably be thinking, what?
Listen, if you were doing this interview with our entire group, they would have instantly had an answer for that. So.
Yeah.
Well, we're a lot altogether.
But there's a lot of value in the question asking side of a job, because I think a lot of people don't ask enough, right? And so particularly in what you're doing in terms of patient experience, to say well, what if, right? What if we did it this way? Why do we do it this way? Most of the times we're not doing that. We're just assuming the way it's been done is the way it needs to be continuing for whatever reason.
Mm-hmm.
And so I wonder, I'll be curious to check in. Yeah, I'll be curious to hear about that. So going back to patient experience, where do you want that to go? Or where does TOA want that to go? Like, so what's Kayla's view on it, and then what's the corporate view on it? In terms of the committee or the impact of that?
I think the committee is just excited to hear from people that are in the trenches, per se, because again, it's easy as the physician or the mid-level seeing the patient. A lot of times they get a completely different experience in the room than we do as staff or patients. So it's felt good that, although I don't think I would know exactly what to say is what corporate wants to see this become.
Sure.
It just makes me feel good that they acknowledge that it needs to happen and that they're excited for staff to have a voice in it.
So if someone was at a practice or a clinic and they're like, oh, I love the idea of a patient experience committee, how do I create one? What was the genesis? Talk us through the genesis of it, or your perspective on where it came from and what it's supposed to be doing.
Yeah. So, it all kind of wraps up into the core committee. I have 2 other directors that essentially started core, seeing the need for just some employee interaction. Turnover rates were high. Retention was just tough, and the culture just needed a little tweaking based on what we talked about earlier. So the core team was built, and it's basically what's the core of our organization? What's our purpose? How do we feel? What do we want to do? And then we realized that was a lot for one group of people to take on. How can we make some subcommittees to really focus on A, the employee, and then another subcommittee to focus on B, the patient? And I feel like we have really good patient satisfaction scores, but there's still things that we can be doing better.
Sure.
So
that's where it came from. Do you have, I would assume not based on the fact you have a committee, but do you have a single person who's responsible for patient experience higher up, or?
So the core team kind of developed bylaws essentially. So it's a lot like our board members. You can sit on a board, you get voted, nominated, and you have terms. So you basically have to be nominated or nominate yourself that you're interested, and then the core team was like, yes, I think this is a good group of people, and then within that group of people we all had to vote on a chair. So I became the chair for year 1, although I think everybody on my committee is very capable of it, but I definitely have some of the more business financial experience under my belt that I'm excited for them to learn and then kind of pass the baton to someone else.
So what are the other titles or roles that are on the committee?
So we do have one other supervisor who is at the clinic level, but then the other team members are made up of a phone patient care liaison, so someone that answers our phones. We are hoping to get someone from the front desk. We currently have a vacancy that we need to fill. We have 2 x-ray techs that also serve as medical assistants in clinic. So it's been really, really cool to see, hey, here's where we're doing a great job, and here's where I feel like we could work. What are you seeing in your clinics?
So what about the provider perspective or the patient perspective? Like the actual patient?
So we do have a physician that sits on each of the committees, and we try to get them as often as we can, but that's tough to work between hourly staff schedules plus a surgeon's schedule. So when a physician can't join a meeting, the chair or a representative just kind of collaborates with the physician and says, hey, here's what we've got going on. And what we have seen so far with the physician backing is maybe not necessarily saying, I think we should do this, this, and this, but just encouraging us to say, you know what, you're seeing it from this perspective. I trust that, and I'm excited you all want to make this better. And I think they're showing the other physicians that are not involved in the committees, hey, this is a great thing. So and just their support alone, whether they're contributing on a quarterly or monthly call basis is a lot.
And there's an ask, because it's an important perspective too, right? Because the patient, and certainly from my perspective, the patient experience matters a lot, right? And particularly in healthcare, there's been traditionally been not as much of a view of that, or it's been more about the clinician, or it's been more about just the financial side of it, right? How do we get paid for this, right? And kind of not who cares about the patient, of course not, but sometimes forgotten in the midst of all that. But it still matters. In your guys' case, the doc is going to have a real viewpoint of, hey, it needs to be this way, right? from my perspective, it needs to be this way. They may not, that may be in conflict with the patient experience for whatever reason.
Or just the medical rationale, you know?
Right.
I mean, a doctor is very much like a diesel engineer where he's going in and he sees like this nut and bolt is not quite working and that's why your whole engine's not working.
Right.
But to explain that to somebody that may not be as receptive to hearing what's wrong,
Sure.
that's been tough too. So you're trying to kind of bridge the gap between, I hear what you're saying and you're very smart and you definitely have diagnosed this, but here's the perception of what the patient has heard.
Sure.
What can we do to kind of bridge the gap between their knowledge base and your knowledge
Right.
base? So
We had just a story. We had a client once who is a surgeon, and he wanted to have more of a certain type of procedure, but he wasn't quite sure how to do that. And we were meeting, and he said, I was talking with somebody, and they just suggested like putting up a poster in the treatment room. They would ask the question, like, because he didn't want to feel like he was selling the service, right? But he was like, I'm happy to provide it to people who need this procedure. I just don't want to feel like I'm selling it. And he's like, what do you think of that? I was like, if that makes you more comfortable, if someone can look at a poster on the wall and say, hey, can you tell me more about that? And you're happy to tell them about that. That's a great win-win across the board, right? Because it's allowing the conversation to start without you having to be the genesis of that conversation. Because then you're not feeling you're selling this thing to the patient. But it does matter, right? It creates a better patient experience when, because the other side of that too, actually, I think sometimes get lost is the patient wants someone to be involved in their life, right? They want the questions to be asked, right?
yeah. Well, sometimes they don't know what questions to ask.
Right. Yeah.
So.
So when someone's asking them about what are you doing or how's this, have you ever considered these kinds of things? They're like, oh, I never had, because I didn't know that was an option. I didn't know this thing was possible. And now you're maybe telling me it is. So, which is, again, it goes back to the empathy, right? Someone thinking about them, not just, there's actually a study, I can share it with you if you haven't seen it, but it's from I think it's called the Beryl Institute, the Beryl. I may not say it correctly, but they have the 10 things patients care about.
Oh,
And
I would love that.
one of the, it's ranked orders, like preference. And one of them is they want to feel heard, which is not, it's just that. It's having empathy to say, why are you here?
Yeah.
How can we help? One of the other ones, the top 5 is respect, which I think goes to the generational side, I think, because respect is something that you and I may have different versions of what does respect feel like, right? So now we're dealing with, I think I'm being respectful when I do X, Y, and Z. You think I'm being disrespectful because I didn't do A, B, C, which those are different kind of worldviews to some degree, but they conflict when, and so how do we solve that? How do we help people understand that?
I like that. I'm intrigued.
Yeah, no, it's, and I think the point of it is the study is just how do we help patients kind of get what they need out of this? Because like you talked about earlier, we were talking about health systems.
Yeah.
It's like, but if someone could get more convenient care and they understand it's more convenient someplace else, or they're just confused, they're more likely to go someplace else.
Yeah.
And so then you just have potentially lost a patient because of communication, not because of
the physician's ability
Right.
or anything else. But yeah, 100%.
And so how do we make sure that kind of becomes more paramount? So on your, I know it's a patient experience committee, but do you have other operational viewpoints on there as well? Are you having people from billing? Are you having those kinds of
So we're hoping to.
Okay.
Our collections department, I would love to have somebody from there.
Yeah.
I've kind of been adjunct collections a little bit because they've been down.
Sure.
Definitely not doing it like they are doing it by all means, but I mean, they're getting like upwards of 70 something calls. That's just voicemails a day. And there's not a lot of people that call in to talk about their bill that they don't have some questions or maybe a preconceived notion of how the call is going to go. And so those are some tough conversations.
Yeah.
So I would love to get them. Shout out to my collections team if you want to be on the patient experience committee.
but a common inflection point for patient experience, right? What's it cost? Why did it cost this? Why did I get billed this? What I can't pay this. I don't want to pay this. Or I don't understand.
And you're seeing more of people that are wanting that information, and they should. They are owed that information.
Yeah.
Good faith estimate going into something.
Yeah.
Especially with elective cases.
Sure.
But you're seeing more and more patients that have plans that they don't understand.
Sure.
overwhelming. People oftentimes get defensive even before the procedures or conversations start because they just feel like they don't know what's going on. So trying to find systems and processes to make that really smooth and streamlined.
Yeah. When you overhear or are part of those conversations, where are the typical sticking points?
As far as I want to know what I'm going to owe today for a procedure that I'm thinking about having 3 months from now.
Yeah.
That one's tough because the physician could get in, let's say it's a knee, and think that you need a partial replacement, but then see that the damage is a little bit more extreme and maybe you need a total or something of that nature.
Yeah.
Or your plan could change in 3 months from now. Your deductible could be more met 3 months from now. So it's really hard to give people estimates of that nature. And then people get frustrated because they think it's like going to Amazon or the grocery store.
Yep.
You know, I should be able to put this in my cart. So we have partnered with a group that you can go to our website and see, but we have very direct packages for most things in our practice.
Yeah.
And we didn't do a lot of marketing for that in the beginning because we wanted to see how patients were perceiving it. And I can't remember the exact statistics. I would have to ask my CRO. But I believe we ended up with like 34 to maybe 80 something hits on the first month without direct marketing. Just telling patients, hey, okay, you don't have health insurance, buy this package. Here's what it includes.
Yeah. And so the reception of that has been positive.
I think so. I mean, it's been a little cumbersome on the back end to some degree, but it's made the conversations easier at the front desk because before the front desk would have to pull up a piece of paper and go line item by line item, and that's just painful. Whereas now they say, oh, okay, for a new patient evaluation, you're going to pay this.
Yeah.
So
that's smart. Where did that idea come from?
You know, again, I don't want to take credit. I'm speaking a lot about the awesome people I work with that have worked on things that I have not worked on.
Yeah.
But it was our marketing team, our market president, our chief revenue officer kind of all collaborated together. But also there's rules and laws coming down the pipeline to where people do have to have more transparent pricing.
Right.
And we really wanted to be sure we were on the forefront of all of
in
that.
the front of it, which is, I mean, someone's got to lead, right? So thank you for doing that. Because
I'll pass the message along to my awesome team.
Yeah. Well, no, I mean, but I do think that's where people want to get involved. And there's too many my personal view is it's too cumbersome because of all the moving pieces for a patient to really be able to understand all of it, right? Like what you just talked about, like, well, your deductible could change, or like all these kinds of pieces.
Yeah.
And maybe the answer is they're not looking for maybe the what if is, well, are they actually looking for a specific dollars and cents? Are they looking for a general direction of it's going to be in this ballpark?
Yeah.
Right. This is what you should expect to pay if these kinds of things happen.
Yeah.
Or and again, no one can predict the future. However, this is generally what it's going to look like. Yeah. Like, because then that helps them make a decision or helps them at least be prepared.
And financial planning. I mean, let's just be honest. I think all of our pockets have felt a little different lately over the inflation of rent and food. And people are truly having to make decisions on, are we going to go on this vacation? Right. Am I going to put food on my family's table, or am I going to have this elective procedure to not be in pain?
Right.
Kind of thing.
Yeah. Yeah. I was at an event with one of my kids' things, and there was a person I was talking to, and he stopped mid conversation. He said, I chipped a tooth, and I think I hit a nerve, but I'm just waiting until the next whatever until I can kind of get this sorted. And I'm thinking, but that's probably more people than probably a lot of walking wounded out there who have those kinds of things happening, and they would love to have some resolution to the pain, but the financial side of it's a discouragement, at least at this point. So one of the things that I really like to ask is, what are you learning from? So it sounds like you definitely have lots of learnings you've been doing and readings, but what are you reading? What are you listening to? Where do you get new knowledge, Kayla?
I knew you were going to ask that. This is probably one that won't make the cut, but
hey, go for it.
I am not great about listening to educational podcasts or reading news articles per se.
Yeah.
I'm kind of a read for pleasure type person.
So what are you reading?
So right now I'm reading Rock, Paper, Scissors. I'm very fresh into it, but it's got some like thriller involvement, maybe some romance type concerns in it. So I read just to kind of unwind and relax.
That's great.
But
I'm not familiar with rock, paper, scissors. So, I mean, I know the game, but I don't know the book. So, what's the premise?
I'm going to be honest, book club just chose it. And
Yeah.
we all chose it over several glasses of wine. And I'm
Okay.
only 2 chapters in. So when I get a little further in,
Okay.
I'll let you know.
So, tell me about book club. I'm intrigued by that. So,
Okay.
what's book club look like for you?
So I'm very lucky to live in a suburban area, but some of our closest friends are our neighbors.
Okay.
It's literally a village.
Okay.
And we got tired of feeling like all we do is go home after work
Yeah.
and then maybe sit around in the yard and have a couple beverages or hash out what the kids are doing. And we're like, why don't we just do a book club? Something that the guys can't be involved in. It's just girls only. Because, we started with like, let's do a Christmas craft where we make something homemade to give to people.
Yeah, sure.
And then the guys kept just trickling in. And as much as we love our husbands, it's kind of nice to do some girl stuff.
Everybody needs a break. Sure.
So then once they kind of bled into Christmas craft, we were like, okay, let's try book club. So we tried book club. And then they started coming for that too. Because when there's
so that
food,
was not sufficiently leading
we
on
keep
enough.
our separate tables for both events.
Okay.
The men are kind of in the inside where the ladies are outside on nice weather. But, you make food and they just come.
Yeah.
They're like stray cats.
So is it still that same iteration or have you modified it again?
No. It's
So it's
still
not
about
books
the
and
same.
no food. So you get
It's
rid of
always
them.
books and food.
Okay, books and food and wine or something.
Wine, yeah.
Yep.
And then I'm going to be honest, sometimes we finish the book and sometimes we don't. But
Sure.
I have such an awesome group of gal pals that we can just be very honest with each other.
That's fun. So what's the process of picking a book?
We all come to book club
Yep.
having read said book
Yep.
and then come with additional suggestions.
Okay.
And then I don't know how we managed to do this in a group of like 4 or 5 women, but
Sure.
we just easily agree on one book.
Yeah.
And then if we don't like it afterwards, we definitely tear the other person down who brought it as a suggestion.
Sure, I
No, I'm
understand.
just joking.
What's the cadence? How often do you guys meet?
That's dependent on life events.
Yeah, sure.
But we try to do it every couple months.
Okay. So you have 2 or 3 months to read the book?
Yeah, some are faster readers than others.
Sure.
Me, I get about 3 pages in and then I find myself asleep.
Okay.
And
So-
it's not because the book's not interesting. It's
Sure.
just because I finally slowed down.
You have a very full life. Yeah. Is there anything else you want to talk about today we didn't cover? We should.
I don't know.
Yeah.
I really don't know. I feel like I talked a lot and gave a lot of information.
No, it's awesome. You're doing great.
I just hope that somebody listens to this and feels inspired because there's days when you walk into healthcare that you just feel completely defeated.
Yeah.
That you're not making a difference. But, if you can just have that one moment of inspiration, then you can bleed that into everybody else.
So that's good. That's a good thing to jump on. So do you have a moment of inspiration that you lean on when you have a day you're like, there's been a lot of traffic, there's a lot going on. You're like, today's not going to be, today might be a hard day.
Yeah.
Do you have a go-to thing you do or a specific memory you have?
Not a specific memory, but
Yeah.
I tell myself, hey, today's a hard day, but it's not just a hard day for you. There's probably 17 people around you that are really struggling with something.
Yeah.
So sorry.
Yeah, no.
My mom recently passed away, so I'm going to try to not talk about it and cry.
Yeah.
But I'm not the only person that's grieving.
Yeah.
And so that's what I remember when I walk in the door, that there's someone else that's worried about their mom or missing their child. And so I try to really encourage my staff to do the same thing. Try to remember that patient that's not been kind. It might not be because of you, or it's not personal. It's not personal.
Yeah.
So that's what inspires me. It's just remembering that things are not personal, and you just have to do what you can to make somebody's day good.
Yeah.
So
Thank you for sharing that.
yeah, sorry.
No.
I told myself I wasn't going to talk about that or cry because nobody wants someone to cry.
No, crying's okay.
Yeah,
It's a real thing.
yeah, but
We have a phrase that we got from a book I read that's from a soccer coach, but his phrase is "mean no offense and take no offense."
Yeah,
right.
I
And just
love
this
that.
idea of like, and I think I may have gotten that backwards. Maybe take no offense, but mean no offense, right?
Yeah.
Like, assume the other person.
and it's hard to do when the guy's like riding you real hard and then tries to cut you off. It's really hard to not take that personal.
It
But then I
100%
tell
is.
myself he might be rushing somewhere because he has a sick mom and he's worried about her.
Yeah.
You just never know.
You have no idea what everyone else's reality is.
Yeah.
And I think that the upside in healthcare, or maybe the upside, but I think the reality is that no one who's in your office, because that's where they wanted to be that
Yeah.
day, right?
It feels weird to tell patients, like, I'm so glad you came today.
Yeah.
Because that means they're hurting and you don't
Yeah.
want them to hurt. But
Yeah.
I say that and I truly mean it, because I'm like, I'm glad that you're coming to be helped.
Yeah.
And that you chose us, because there are other choices.
There are other choices. And I think the reality is they need help, right?
Mm-hmm.
Like the truth is that they don't want to be there, but they do need help, and they cannot get from their point of pain to resolution without your guys' help, right? Whether that's navigating, like, okay, great, I have forms to fill and I don't understand the forms, or what's it going to cost, and now like there's a process, and you guys are really the guides to getting them through that process, so that they can actually get care and receive care, so that they can get back to what they want to be, their life to be, what they wanted that Saturday to actually look like, not that what it turned into be because of whatever happened. So
I'll never forget this lady that had injured her wrist, and she was a grandma, and she may not be your athlete, and she may not be playing volleyball on the weekends, but she was so sad because she couldn't hold her grandbaby and pick up her grandchild. And so it's important to understand like what makes the patient tick and why they want to get better.
Yeah.
So.
And that goes back to empathy. So that's a good way to land it. So, Kayla, thank you so much for being here today.
Thank you.
This has been awesome.
For putting up with me. And
no, there's been no putting up at all. This has
laughing,
been incredible. No, this is great. Thank you for listening to the Growth Unbound podcast today. Be sure to let us know what you think, and we'll be back soon with more inspiring stories and insights to help you unlock the growth you deserve. I'll see you next time.